Welcome back to Talk of the Town. And with me today I have Dr. James Maginnis.
Hi.
Welcome, Dr. Maginnis.
Thank you.
Maginnis Orthodontics. And Dr. Maginnis, we're going to talk a little bit about orthodontics and when you think children should see an orthodontist.
Well, the American Association of Orthodontists typically recommends the first evaluation to be around 7 years old. Now, usually children are being seen by their dentist, and their dentist can give them a general idea if they need to come see me at that time or maybe a little bit later on. But if a parent has any questions, we typically take a look at the child and just give them an idea if they need anything at that point in time or if they should just wait until they get closer to middle school or have all their teeth come on them. The reason why 7 years old is because at that point in time we can intercept some growth problems if somebody's got something called a crossbite, a narrowness of the upper jaw, an underbite, or a severe overbite where the teeth could be traumatized in sports and recreation. Also, we can intercept some eruption problems as well. Usually I don't do anything at 7 years old or around that age, but a lot of times it just helps us to get an exam at that point in time to give the parents some information and a general idea as far as what they can expect. We can monitor the patients or just say come on back in around 6th grade or something like that.
What about Invisalign versus braces? How would one know what would be the best option?
Well, an Invisalign trained orthodontist will be able to help educate the patient as far as if it's going to be a better option for them or not. Invisalign is a great system. It's composed of several different clear plastic aligners, and these aligners are worn approximately 2 weeks at a time, all day and all night except for when a patient is eating. Now, Invisalign can do certain types of tooth movements which may be acceptable to the patient if they don't want to have a tooth moved up or down. Invisalign has a tougher time doing that. But if that's an issue, braces may be more of more indicated, if you will. Invisalign sometimes can be quicker, sometimes it can be a little slower than braces. But the big advantage to it is it's aesthetic, it's comfortable, it's easily worn, there are no dietary restrictions, and no one has to know you're wearing it.
Do you wear them 24/7?
Tooth movement requires continuous pressure on the teeth, so it's just not a nighttime orthodontic appliance. Basically, when we move teeth, the bone movement is required by several different cells that unfortunately require continuous pressure. And braces are one way of doing it, retainer is another way of doing it, and Invisalign is a newer way of doing it.
And as far as what the braces are now versus what they used to be decades ago. I remember kids running through school with purple and red and metal and headgears and oh my goodness.
There are a lot of different things we have available. We still have traditional braces that are similar to what we're seeing here, kind of a a stainless steel mini style, if you will, so it's not quite as big.
Are those jewels in those teeth?
Yeah. Well, sometimes kids do call them, jewelry, if you will. But no, it's they change out the colors every time, and the kids like it because it's fun. For some of our adults who, Invisalign's not going to work for them, and they're concerned about aesthetics, we do have clear ceramic style braces, which are nearly invisible. You still see a little bit of something, but it's not quite as noticeable as the traditional metal style. But the bottom line is braces provide us a point to apply a force to move a tooth in a desired direction or a track to slide teeth along to help correct overbites, bite problems, things such as that.
So you do treat from young to old,
About
correct?
20% of our practice are adults, and adults being classified as anybody over the age of 18. I'd say our average adult patient is going to be female, probably in her mid to late 50s. Now, braces just just because I use the word braces doesn't necessarily mean people are going to get something on top and bottom and for 2 years and you have to have teeth out or something like that. There are plenty of times where we see patients where we do braces on the bottom only to address a problem. Sometimes just some simple alignment takes